The largest Ebola epidemic to date is waning, but experts say it will make a comeback.
That's why those on the front lines have been studying better ways to diagnose and treat that often deadly virus. Health Check 10's Barbara Morse Silva spoke with a local doc who's taking the lead.
Dr. Adam Levine is used to treating the sickest of the sick here in Rhode Island Hospital's busy emergency department. Add to his resume time spent treating Ebola patients in Liberia.
It was my first time in Liberia and my first time managing Ebola. I was there with International Medical Corps in August and September, and I helped them set up their first Ebola treatment unit. As the medical director for the Ebola treatment unit, first on my mind was making sure that my staff, both my international staff coming from the US and Europe, but also the 90% of the staff that was local Liberians, making sure that they were kept safe.
What he learned has been published in the Annals of Emergency Medicine. He found with protocols in place, you could develop a clinical prediction model, what he calls the Ebola prediction score, for those suspected of having Ebola while waiting for laboratory confirmation.
So one of the things that this Ebola prediction score does well is it helps us risk stratify patients. So based on their score, the higher the score, the more likely it is that they actually have Ebola. The lower the score, the more likely it is that they have some other disease.
This score was based on a number of symptoms such as fever, nausea and vomiting, muscle and joint pain. The more symptoms, the higher the score and subsequent risk.
It was developed to separate patients who have Ebola from those who have other diseases like typhoid, malaria, etc., that are prevalent in West Africa.
Dr. Levine says he took what he learned in West Africa and worked with the Department of Health to develop a rapid response strategy in Rhode Island. Dr. Levine says this is a first step, and now the hope is to come up with better ways to treat this deadly virus, not if, but when there is another outbreak. With this special Health Check 10 report, Barbara Morse Silva, NBC 10 News.